American drug makers have been asked to voluntarily lower the cost of prescription drugs within 30 days. President Trump signed an executive order today threatening to negotiate new drug prices, that is, if that demand is met. This move came just hours after the Republican-led House released a new plan to cut $880 billion from Medicaid. Now let's bring in Monty Kamposh. He owns the Tel 12 pharmacy over in Southfield. We appreciate you taking time to talk to us. We want to get some perspective in terms of these prices. How realistic do you think it is for these prices to actually make this drop in 30 days?
Probably not too realistic in the beginning, but maybe sooner than later. It's probably long overdue because the cost of medications are just out of control, and these pharmaceutical companies and insurance companies are just dictating the world. But I'm glad that something is in the works and going to change, hopefully for the better for the consumer and for everybody else in the pharmacy world.
Obviously, we've reported on this for years, especially for that senior population that really are living, more than paycheck to paycheck in terms of the limited dollars that they have. From your experience, what do you think in terms of insurance costs? How much of a change is this going to affect?
Probably not a lot in the beginning because the insurance companies, the PBMs, dictate the world, unfortunately. But hopefully things will come around. I mean, it's a battle every day. My seniors come in here all the time. It's either pay for prescriptions or food. It's ridiculous that these poor people have to be subjected to that. It's mostly the auto workers, the retirees. They feel it the most right now, and we work with them as much as we can. But it's tough out there. It really is.
So what do you think in terms of access? Could this actually affect access to drugs?
Maybe, maybe not. Maybe the floodgate might open, and all these other companies might say, "Hey, we got to do what the president says, and we don't want to be caught behind the eight ball." Medication world is a penny business.
Yeah,
and some of these medications don't cost that much to make, but they charge a lot of money, and the reimbursements are awful, and they pass it along to everybody, the consumer, the seniors, us, everybody else.
Monty,
it's awful.
I was going to ask one last question real quick, if you don't mind, because I know you're busy. The president says he wants the U.S. to pay what Europe is paying for prescription drugs. Talk to me about that discrepancy. How much of a difference is there and why?
So that's funny. People always say we can go to Canada and get the medications for almost a third of the price, or maybe at cost what it costs us here in the U.S. If that's the case, that's a win-win situation for a lot of people to get medications that reasonable, that cheap, because the European market is very, very cheap compared to the U.S. market. Absolutely.
Obviously, we'll see how this develops in the next 30 days. Most likely, it's going to take longer than that. Monty, we appreciate your time. We really do. Thank you.
Anytime. You're welcome. Have a great day.
All right, you too.